Due to the COVID-19 pandemic, the world stops. But not the determination of the to be a registered professional. Welcome to our online quiz.
Hello nurses, midwives, and top notchers. Welcome back to my YouTube channel. So thank you for subscribing to my channel. And kung bago ka lamang po dito sa aking channel, just click the button below to subscribe. And don't forget to click the bell button for more video updates. At kung natuwa po kayo sa aking mga video uploads, don't forget to like and share the video. And kung gusto nyo po ng mga bagong concept na aking lecture, just comment below yung mga gusto nyo pong matutunan at akin pong gagawan ng lecture videos. So our topic for today is all about your universal protocol, which is being used in the operating room, the three-step process known as the sign-in, the time-out, and the sign-out process. Okay? So, in July 2004, the Joint Commission enacted a universal protocol that was developed through expert in consensus on principles and steps for preventing the wrong site, the wrong procedure, and the wrong person surgery. So, take note that the universal protocol applies to all accredited hospitals, ambulatory care, and office-based surgery facilities. The universal protocol is designed to ensure the correct patient identity, the correct scheduled procedure, and the correct surgical site, consisting of the following three components. Number 1 is the pre-procedure verification process, and number 2 is the surgical site marking, and number 3 is the surgical timeout immediately prior to starting the procedure. Again, so the three components of your universal protocol includes number 1, a pre-procedure verification process, number 2, surgical site marking, and number 3 is the surgical timeout immediately prior to starting the procedure. So take note that your universal protocol is designed to ensure the correct patient identity, correct scheduled procedure, and correct surgical site. Okay, so let's talk about first your pre-procedure check-in, so which is being performed in the pre-operative ready area. So, in the pre-procedure check-in, the patient or the patient representative actively confirms with the registered nurse the patient identity, the procedure and the procedure site, the consent and the site marked by the person performing the procedure, which is usually the lead surgeon. Okay? Again, so during your pre-procedure check-in, the patient or the patient representative actively confirms with the registered nurse the patient identity, the procedure and the procedure site, the consent and the site marked by the person performing the procedure, which is specifically it is the lead surgeon. Okay? So tandaan po natin yan. So during your pre-procedure check-in, so kailangan natin i-confirm with the patient or the patient representative yung identity ng patient na mag-undergo ng procedure, yung procedure at saka yung procedure site, and kung na-obtain na ba or na-secure na ba yung ating consent for the procedure. So take note, pag lumabas po sa board exam, so the surgeon is the responsible and the authorized person to obtain the consent for the surgical procedure and not the nurse. Tandaan niyo po yan, lumalabas po yan sa board exam, si surgeon po ang mag-o-obtain ng consent at hindi si nurse. So siya po ang pinaka-responsible person in the surgical team na mag-obtain ng consent for the procedure. It is the surgeon. And take note that the site for your operation is marked by the person performing the procedure at yun yung ating lead surgeon. Okay? So aside from confirmation of your patient or the patient identity, the procedure and the procedure site, the consent and the mark site by the surgeon, so the nurse must confirm also the presence of history and physical assessment, the pre-anesthesia assessment, the nursing assessment, and diagnostic and radiologic test result, also with the blood products and any special equipment or devices or implants found in your patient. So yun po yung ating ginagawa sa ating pre-procedural check-in. Okay, again, so the nurse must also confirm the presence of history and physical assessment, the pre-anesthesia assessment, nursing assessment, diagnostic and radiologic test results, blood products, and any special equipment or devices, implants, which can be found into your patient. Okay, so yun pa ating ginagawa. And bukod pa doon, we must also include in your pre-procedure check-in yung pagbibigay natin ng mga gamot or medications like your beta blockers or the drugs for your venous thromboembolism prophylaxis and your normothermia measures. Okay? Then next, after your pre-procedure check-in, we have also this sign-in phase. Okay, so if we say sign-in phase, nurses, this is usually performed before the induction of anesthesia. So the registered nurse and the anesthesiologist will confirm the following: the identity of the patient. So i-check ni nurse dito kung suot ba ni patient yung bracelet niya, okay, yung kanyang identity bracelet. Then next, we have also your procedure, then the procedure site, and kung na-obtain na ba yung consent for the procedure. So sinabi ko nga kanina na yung ating consent for the procedure is usually obtained by the surgeon and not by the nurse. So as a nurse, you must only confirm for the presence of your consent. Okay, so i-check mo lang kung na-obtain ba yung consent for the procedure. And take note, nurses, that in your securing or obtaining of your informed consent or the consent for the procedure, obtain consent prior to the administration of your preoperative medications para hindi po maapektuhan yung pagdesisyon ng ating patient. So, aside sa ating confirmation of your patient identity, procedure, and procedure site, and the obtaining of the consent, the nurse here should also confirm for the presence of your marked site for the procedure. So, marking of the site for the procedure should be performed by the person performing the procedure, and that is the surgeon. So, the lead surgeon must perform the marking of the site. So, in your marking of the site, kailangan nating tatandaan yung ating mnemonics na site mark. Okay? So, site mark is our mnemonics. S is for surgeon performs the site marking. So take note that responsibility of site marking should be confirmed by adding the surgeon's initial. Okay? So maliban na lang kung ang kanyang pangalan nagsisimula sa NO. Okay? So example, kung ang pangalan niya ay Nestor Osmeña, hindi po niya pwedeng gamitin yung initial na NO. Kasi kung babasahin mo na yung NO na initial, that is no. And it will imply that the mark site should not be operated on. So hindi po pwedeng maglagay ng initial na NO kapag ang pangalan mo ay nag-start sa ating NO. So, bakit? Kasi pagkabasa mo na nun is no, okay? And it implies that the mark should not be operated on. Then next, letter I. So, involve the patient in the site marking process whenever possible. So, for letter I, you must involve the patient in the site marking process whenever possible. Then next, for letter T, terminology should be clearly defined like yes, go, correct, or correct site. So, iwasan po natin gamitin yung X na pang-specify ng ating operation site. Bawal po yun kasi baka malito po tayo na baka ang pagkaintindi po sa letter X na yon ay hindi doon yung operative site. Bawal po yun. Okay, so hanggat maaari, gumamit tayo ng terminology that is clearly defined like yes, go, correct, or correct site. And letter E, always ensure the sterility of the marking ink or the marking pen. So kailangan sterile din po yung gagamitin natin na mark pen para sa ating marking of the site. Then next, for letter M, mark using indelible ink. So use permanent markers. So take note that site marking must be resistant to the surgical preparation process and remain visible at the time of skin incision. So site marking must be applied by indelible ink on the skin using permanent markers. The use of temporary or removable markers like using stickers or marking on cast or dressing is not feasible. So hanggat maaari, ang gagawin po natin na pang-mark sa site of your operation is your indelible ink. So gumamit po tayo dyan ng permanent markers. Then next, for letter A, apply marking at or near the incision site. So apply the marking at or near the incision site. The side, level, and location of the procedure must be unequivocally defined by the marking whenever possible. So kailangan i-mark natin near or at the incision site. Then next, so kapag hindi ka sigurado sa ating site of your incision or sa ating operation site, you can use radiological diagnostic test to increase the accuracy and to confirm the site. That is letter R, radiological diagnostic to increase the accuracy of the operation site. So lalong-lalo na kapag ang ipe-perform mong procedure dito is yung merong mga kinalaman sa ating spinal level marking with a needle or yung mga intraoperative arteriogram or cholangiogram and etc. Okay? So yun po ating tatandaan dyan. So letter R, radiological diagnostic to increase accuracy of the operative site. And for letter K, know the contraindications for your site marking. So, example of your contraindication is kapag ang patient natin is premature infant. Why? Kasi pag premature infant po yan, that is a contraindication for your surgical site marking. Kasi there is a risk of permanent tattoo kapag nilagyan mo siya ng ating site marking. Pwede maging permanente na kasi yung ink na nilagay mo sa kanyang balat kasi nga premature po siya. Okay, so yun po ating tatandaan. So, knowledge of contraindication for surgical site marking. So, sa last part ng ating sign-in phase, meron po tayo ditong tinatawag na briefing. So, we have your briefing which all members of the team have discussed the care plan and addressed the concerns to the patient. So, yun po yung ibig sabihin ng briefing under your sign-in phase. Then next, after ng ating sign-in phase, we have also your time-out phase. So, pag sinabi po nating time-out phase, that is usually performed before skin incision. So, it is initiated by the designated team member and it is usually the circulating nurse. So, yung circulating nurse po yung nagta-time-out sa ating surgical operation. So, take note, during timeout, all other activities are suspended except na lang kapag meron po tayong case of life-threatening emergencies. Okay? So, during your timeout, ano po ba yung ginagawa natin dito? So, number one, we have to introduce the team members. So, introduction of team members, yan ay ginagawa po natin yan sa timeout phase. So, aside sa ating introduction of your team members, under your timeout phase, inuulit natin yung ating confirmation ng patient identity, yung procedure na gagawin, yung incision site, and the presence of your consent of the procedure. So, the site should be marked and visible. So, sabi nga natin kanina, kailangan yung ating site is na marked by the surgeon. So, the site should be marked and visible. Then, nadagdag po dito sa ating timeout phase yung ating fire risk assessment and discussion. The fire risk assessment and discussion. So, meron ba tayong prevention methods na i-implement dito or wala? So, yun pa ilalagay natin dyan kasi dinagdag na po yan sa ating timeout phase. Then, aside sa ating fire risk assessment and discussion, we have also relevant images properly labeled and displayed and any equipment concerns. So, during your timeout phase, meron din tayo dito mga anticipated critical events kung saan yung surgeon naman, i-state naman niya yung mga sumusunod. So, the surgeon should state the following. Number one, critical or non-routine steps. Number two, case duration. And number three, anticipated blood loss. So, take note nurses that the surgeon will state the anticipated blood loss. Siya po yung responsible na mag-state kung meron bang anticipated blood loss. Yung anesthesiologist kasi, siya naman yung mag-state kung naibigay na ba yung ating antibiotic prophylaxis within 1 hour before incision. So, yun naman ang ginagawa or dinedeclare ng anesthesiologist during your timeout phase. So, yung scrub nurse at saka yung ating circulating nurse naman, sila naman yung mag-state ng sterilization indicators kung confirmed na ba yan and yung mga additional concerns at saka nila i-document yung completion ng ating timeout procedure. And remember nurses na itong ating timeout procedure or timeout phase ay na-update na po yan. So, in addition, the timeout was recently expanded to include the verification of correct patient positioning, availability of relevant documents, diagnostic images, instruments and implants, and the need for preoperative antibiotics and other essential medications like your use of beta blockers. So, na-update na po yung ating timeout phase in your surgical operation. Again, so nadagdag na po dyan yung ating correct patient positioning, availability of relevant documents, diagnostic images, instruments and implants, and the need for preoperative antibiotics and other essential medications like your beta blockers and your anti-thrombosis. So, take note that the surgical timeout represents the last part of the universal protocol and is performed in the operating room immediately before and planned procedure is initiated. So, the timeout represents the final recapitulation and reassurance of accurate patient identity, correct surgical site, and planned procedure. And take note nurses na nadagdagan na po yung ating timeout procedure. So, during your timeout phase, in addition, we are now including the correct patient positioning, the need for perioperative antibiotics, the assessment for the presence of allergies, and the availability of relevant documents and diagnostic tests. The instruments, the implants, and other pertinent equipment should be confirmed during your timeout phase. So, take note that the surgical timeout represents the last part of the universal protocol and is performed in the operating room immediately before and planned procedure is initiated. So, the timeout represents the final recapitulation and reassurance of accurate patient identity, correct surgical site, and planned procedure. And take note nurses na nadagdagan na po yung ating timeout procedure. So, during your timeout phase, in addition, we are now including the correct patient positioning, the need for perioperative antibiotics, the assessment for the presence of allergies, and the availability of relevant documents and diagnostic tests. The instruments, the implants, and other pertinent equipment should be confirmed during your timeout phase. So, take note that the following parameters are the key to success for a surgical timeout. So, always remember, a timeout is called by any member of the surgical team, but usually it is the circulating nurse. Okay, so ideally, the patient should be awake and participate in the verification process of the patient identity, surgical site, and the planned procedure. So, it is so-called the awake timeout. Kailangan gising pa dito yung ating pasyente. So, the timeout process must be standardized at every institution. So, the immediate members of the procedure team like the surgeon, anesthesiologist, circulating nurse, and the operating room technician must actively participate in the timeout. In short, lahat po ng nasa loob ng ating operation room or operating room, kailangan nagpa-participate po sila during your timeout phase. Okay? So, during the timeout phase, all other activities are suspended to an extent which does not compromise the patient safety. So, ibig sabihin po niyan, lahat ng mga activities kailangan masuspend during timeout except na lang kapag emergency yung ating operation. So, the timeout must be repeated intraoperatively for every additional procedure performed on the same patient. And after ng ating timeout phase, we have now your sign-out phase. So, yung sign-out phase naman po natin, yan ay pine-perform po yan before the patient leaves the operating room. Okay? So, ano po bang ginagawa natin sa sign-out phase? So, during your sign-out phase, the nurse confirms the name of operative procedure. Ano pa? The completion of the sponge, the sharp, and instrument counts. So, yung ating sponge counting completion, dapat in-state po dito sa ating sign-out phase. And specimens identified and labeled. And also the equipment problems to be addressed and discussion of your wound classification. So, to all team members, what are the key concerns for recovery and management of this patient? So, isusulat mo din yun, okay? So, the briefing is also under part of your sign-out phase. So, under din ng sign-out phase yung ating debriefing. So, pag sinabi natin debriefing with all team members, these are the opportunity for the discussion of team performance, the key events, and any permanent changes in the preference card. Okay, so yun pang ginagawa natin during your sign-out phase. Okay, so after our lecture about your sign-in, timeout, and your sign-out phase, we have these common board questions na meron pong kinalaman sa ating sign-in, timeout, and the sign-out phase. So for the question number 1, the WHO Surgical Safety Checklist aims to increase the safety of patient undergoing surgery. This is being adopted by the hospital's quality department. So based on the checklist, you are aware that the surgeon, the nurse, and the anesthesiologist should be present during the recapitulation and reassurance of correct patient identity, correct site, and correct procedure which occur right before skin incision. So, in what phase should be the above takes place? So, A, the briefing, B, sign out, C, sign in, or D, time out phase. Okay, so keyword in your question number 1. So, sabi dito, the surgeon, the nurse, the anesthesiologist should be present during the recapitulation and reassurance of your correct patient identity, correct site, and correct procedure which occur right before skin incision. So, doon pa lang malalaman mo na yung ating keyword. So, what phase in your universal protocol is being performed right before skin incision? So, the correct answer here is letter D, the timeout phase. Bakit? Kasi yung timeout phase po yung ating ginagawa before your skin incision. So, the activities included in your timeout phase includes the following. So, number 1, we must verify the patient identification during your timeout phase. Number 2, complete a fire risk assessment. Yan po yung bagong naidagdag na sinabi ko kanina. And number 3, to verify the surgical site and procedure to prevent yung wrong site surgery na tinatawag natin. Okay, so again, so we have your activities under your timeout phase. Number 1, verify the patient identification. Number 2, complete a fire risk assessment. Number 3, verify surgical site and procedure. And isa sa mga pinaka-importante din during your timeout is to ensure that consent for the specific procedure was obtained by the surgeon. Tandaan yan, surgeon po ang nag-obtain ng ating consent for the procedure. So, yun po ang ginagawa natin during your timeout phase. So, the correct answer here is letter D. The next, for the question number 2, as the quality improvement officer, you have strongly recommended to the surgery department the adoption of the WHO Surgical Safety Checklist to prevent a wrong site surgery. So, saan daw po ito? So, A, the briefing, B, briefing, C, timeout, or D, surgical site marking. So, eliminate na natin yung ating debriefing at saka briefing kasi yung briefing natin under po yan sa ating sign-in phase. While your debriefing, that is under your timeout phase naman. So, mali yung A, mali yung ating letter B. So, under your WHO surgical safety checklist to prevent a wrong site surgery, we must perform your timeout pa rin. So, letter C is the correct answer here. So, timeout is a necessary component of the WHO surgical safety checklist to reduce the risk of wrong site surgery. So, to ensure patient safety and to reduce the risk associated with surgical procedure, the circulating nurse calls a surgical timeout prior to surgery. So, just before a surgical procedure, all surgical team members complete a surgical timeout to prevent the risk of fire, risk of wrong patient, the risk of wrong site surgery, and the risk of your wrong procedure. So, dito kasi kino-confirm na natin kung tama ba yung ating site for the operation. So, para maiwasan natin yung ating wrong site surgery, we must perform your timeout phase. Letter C is the correct answer here. Then next, question number 3. The Quality Improvement Officer conducts her random visit to the operating room. She asked one of the OR nurses in what phase in the WHO surgical safety checklist will the nurse account for the sponges and needles used in the surgery. So, keyword in your question number 3, the nurse will account for the sponges and needles used. Okay? So, nagamit na daw. So, used in the surgery. So, A, sign out. B, time out. C, sign in or D, debriefing. So, napaka-obvious po ng ating sagot dito which is letter A, sign out phase po yan. So, the correct answer here is sign out phase. Kasi, during the sign out phase, which is before the patient leaves the operating room, the nurse verbally confirms the name of the procedure, the completion of instrument, and your sponge and needle counts, and also with your specimen labeling. So, read the specimen labels aloud, including the patient name. So, whether there are any equipment problems are to be addressed also in your sign-out. Okay, so during the sign-out phase, ang ating kino-confirm dito ay yung name ng procedure, yung completion ng instrument like the sponge and needle counts, and yung labeling of your specimen. So, read the specimen labels aloud, including the patient name. Then next, for question number 4, a sentinel event is an unexpected occurrence involving the death or serious physical or psychological injury to a patient. And as the quality improvement officer, what is your initial step following a sentinel event? A, reporting to the Department of Health. B, immediate investigation. C, corrective action on the personnel. Or letter D, reporting to the Chief Executive Officer. So, initial step following a sentinel event ang tinatanong po dito sa ating question number 4. So, take note that wrong site surgery resulting to injury is an example of your sentinel event. So, take note, nurses, that sentinel events signal a need for immediate investigation and response. So, that is your initial step, okay? Initial action following a sentinel event. So, the first action to be initiated following a sentinel event is for the quality improvement officer to conduct an immediate investigation. So, sentinel event requires an immediate investigation and response. So, the correct answer here is letter B. Then next, for question number 5, based on the World Health Organization surgical safety checklist, which of the following is not included in the sign-out area of the checklist? A, surgeon and anesthesia professional and nurse verbally confirm the patient, the site, and the procedure to be done. B, nurse confirms with the team the instruments, sponge, and needle counts are correct. Or C, whether there are equipment problems to be addressed. Or letter D, nurse confirms with the team the name of the procedure recorded and how specimen is labeled. So, ang tinatanong po dito is yung hindi kasali, not included in the sign-out area of the checklist. So, take note, nurses, that your option letter B, option letter C, and option letter D are activities included during your sign-out phase. So, the correct answer here is letter A. Why? Kasi surgeon and anesthesia professional and the nurse that verbally confirms the patient, the site, and procedure to be done is under your sign-in phase at hindi po yan sa sign-out phase. So, take note that during the sign-out phase, which is before the patient leaves the operating room, the nurse will verbally confirms the name of the procedure, the completion of the instrument, the sponge and needle counts, and the specimen labeling. Whether there are any equipment problems are to be addressed also. So the correct answer here is letter A. The next question number 6. The person in the operating room responsible for labeling and handling surgical specimen correctly is the A. Scrub nurse, B. Circulating nurse, C. Surgeon, or D. Anesthesiologist. So take note, the correct answer here is letter A. Scrub nurse po yan. So for labeling and handling of specimens, it is the task of the scrub nurse. So letter A is the correct answer kapag lumabas po yan sa inyong board exam. And last question. So, who is responsible for accompanying the surgical client to the post-anesthesia recovery area after surgery and for giving a report of the client's intraoperative experience to the PACU nurse? A. The surgeon and the scrub nurse. B. The surgeon and the circulating nurse. C. The anesthesiologist and the scrub nurse. Or letter D. The anesthesiologist and circulating nurse. Okay? So, sino daw ang mag-accompany sa ating patient going to PACU unit? So, the correct answer here is letter D, the anesthesiologist and the circulating nurse. So, take note, nurses, that the anesthesiologist and the circulating nurse are responsible for accompanying the client to the post-operative recovery area and giving a report to the client's intraoperative experiences. So, letter D is the correct answer. At kapag na-receive na po yan ng ating PACU nurse, ang gagawin po ni nurse dyan is to assess the vital signs of the patient, the airway, the breathing, and your circulation. So, the correct answer here is letter D.